Hi, Sally Walker here, your hormone and slow age expert. So, what are the top health risks for the aging male? So, on the top of the list, worldwide, there is no discussion here. It is heart disease. That's your top one. Yes. So, you want to be doing checkups. You want to be checking your blood pressure on a regular basis. You can do this at home, and it's one of the best things that you can do, really. Second leading cause of death is cancer, and we've got cancers like prostate cancer, we've got colon or colorectal as it's also called, we've got lung cancer, and we've got skin cancer. These are the four top cancers for the aging male. The third leading cause of death, this is a really, really interesting one, and one you would not have expected, I think, but it's accidental injuries. You boys are much bigger risk takers, yes. So accidental injuries from stupid things, maybe like not wearing a seatbelt, is the third leading cause of death with you boys, yeah. So what else is on your list? Well, you've got diabetes, type 2 diabetes. So it was previously called age onset because we only saw it in adults above the age of about 50. So now we call it type 2 diabetes. But yeah, there is an increased risk for diabetes as we age, both male and female, but we're talking about you boys at the moment. So another health problem, is not a cause of death, but erectile dysfunction is one of the things that becomes more prevalent as you age. Sarcopenia, loss of muscle tissue, that is a major concern for both male and female as we age, because muscle tissue is really, really glucose hungry, and it affects your metabolism more than anything else. So building muscle tissue, maintaining muscle tissue should be on the top of your list of priorities. Then you've got the bone problem, so osteopenia, osteoporosis, that kind of thing, loss of bone tissue is another one. Depression is something that you boys also suffer with, but you tend to express your depression in a different way than the girls, so you may be extra angry than you used to be, which is your symptom of depression. Then we've got the benign prostate hyperplasia, so the BPHs, so the enlarged prostate, not prostate cancer, that is on the list obviously, but this is the benign prostate cancer. And basically, if you get to the age of 80 and you are not having any symptoms or challenges with your prostate as being benign, enlarged, you have won the lottery because this is something which happens to the biggest majority of men, starting maybe already around the age of 40, definitely by the age of 50, and it just gets worse and worse as the years go by for some men. Most men. So liver disease is on the list, so careful with your alcohol. COPD, so the lung disease is on the list as well. And alcohol in itself is one of the factors that will increase your risk for disease. So be careful with excess alcohol. I'm not saying don't drink it at all. Anyway, check the blog. This article is in the blog as well, so have a little read about the different health risks which are on your list. I've just listed them for you, but you can have a little read down in the blog. Happy hormones, happy life.